images. So basically, this topic gives you the idea about selecting your abutment for your fixed partial tension. So these are the contents for your today's topic. It includes the introduction, the definitions of abutment, various types of assessment, how do you do the assessment for your abutment selection, the criteria for the abutment selection, and the various factors which governs your abutment selection, which includes biomechanical considerations for the selection of your abutment, length of your span, precision gel thickness of the contact, and other stuff. And the last one is your questionnaire abutment. So, and after that, we conclude and give some of the references for your study purpose. So, as we all know, the selection of your abutment is very crucial in success of your fixed partial denture. So your abutment with the restoration which you have chosen for your tooth to withstand all the occlusal forces constantly. If it is not withstanding the forces, occlusal forces constantly, then we have a problem in your fixed partial denture. So basically, the more amount of forces will be tolerated by your missing tooth, that is your contact. So all the forces will be transferred then to your abutment tooth. So we make sure that the abutment tooth is strong enough to make sure that it absorbs all of the forces. It will take or withstand all of the occlusal forces constantly and without failing your fixed partial denture. So the glossary of the proceeding term defines the abutment as a tooth or the portion of the tooth, or that the portion of the dental implant that serves and support the remaining processes. So basically, we have a contact, a retainer, and an abutment. So basically, the abutment is defined as again a tooth, a portion of tooth that are the portion of your dental implant which serves or to support the or a retainer prosthesis. So basically, abutment selection is done by various methods. The first method is to assess your abutment is making a diagnostic cast. The accurate diagnostic cast can be used basically uh, to orient the transverse injection to the plane of the occlusion on an articulator, which will permit your eccentric and the centric movement, similar to the movements which is taken in your patient's mouth. So it is very useful for diagnostic purposes. Okay. It will allow you to evaluate the opposite relationship of the dental arches and the abutment teeth. Can give you the proper idea about the rotator and the bulbous teeth when you observe in an articulator. It can provide you the form and the contour of the abutment teeth and the some amount of gingival tissue which can be easily evaluated in the diagnostic cast. And we can check the alignment and the contacts of the opposing tooth before making any preparation or going for a fixed partial denture. So these are the simple evaluations we go for a articulated cast or the diagnostic cast. When you go for the radiographic examination, the purpose of radiographic examination is to disclose the hidden areas and the structures which will be helpful in the first diagnosis of your fixed partial denture or the abutment tooth, how it is, and it can be used for the tooth preparation or the fabrication of fixed partial denture. So basically, the first one and the most important is the morphology of the root, the pulpal outline, the periodontal space around your abutment tooth, the alveolar bone, the location and the presence of alveolar bone. Introgonic defects are present or not, the residual roots are how they are present. If they are present, we have to remove it and reconsider our abutment. The impacted of the supernumerary root, which can be used uh, impacted which can be removed with the help of your surgical procedures. The extent and the present of the past caries. If the caries are present, it should be evaluated properly and the caries removal should be performed. So basically, these are the radiographic examination we make sure. So wherever possible, your abutment tooth should be whitened. If it is not, we can go for an RCT or the root canal treated tooth when it is asymptomatic. If it is not asymptomatic, if it is symptomatic, if the patient is saying he is having a pain, we should not go for the fixed partial denture. So we make sure that there is a proper complete obturation of the root canal before you can go for the abutment for the preparation of the tooth. So basically, your tooth must be sound and you have the proper coronal tooth structure before you ensure the longevity of the tooth. Okay. If you don't have any proper coronal tooth structure, we don't go for it. We do the prior procedures which can help you in the uh, gaining the proper tooth structure, coronal structure for your abutment. So basically, when we go for the teeth, which have which can be pulp capped, should not be used for the FPD as abutment. The pulp cap cannot be used because these are the the pediatric tooth which cannot be used for the abutments. There will be greater risk after the endodontic treatment later on. Okay, there will be a problem in the young adults basically because we have the pulp counts very high and broad in the young adults. So we make sure that the proper age is useful for the ratio abutment. The supporting tissues and the structure of the abutment teeth must be healthy and free from any inflammation present in you before you plan for the prosthesis. To make sure that the surrounding tissues, the gingival tissue should be have the adequate, proper, free from the inflammation and the healthy structure around it. So basically, when we go for the abutment teeth, you just tend to use it should not have any mobility present in the tooth structure. If it is there, we should not take the tooth which is mobile as an abutment. So there are various factors that influences the abutment selection. The first one is your crown, the look how the crown is present, the crown root ratio, the root configuration, the parental ligament area, the long axis relationship, and the last one is the location of the arch. So the crown is very important for giving any type of fixed partial denture. The crown length plays a vital or the major role in your selection of your abutment. So basically, we should have a proper sound and surviving tooth structure which can withstand the fixed partial denture for long period of time. That is the longevity for your FPD, and it should ensure all the retention which can be gathered from the surface area of your crown, which is giving the more amount of retention. So these two or these three basically uh, properties of your tooth should be there, or the crown should be there. It should be sound, survive the tooth structure. Make sure that it is useful for your retention and the longevity. So basically, the crown molding procedure can be performed if you don't have the adequate crown height. Okay, the crown height is less. In such cases, we go for the crown lengthening procedure. Increase the length of the crown. Okay. The short clinical crowns are not adequate for your proper retention for your abutment selection. So basically, we increase the crown height by crown lengthening procedure. Then comes the size of the crown. Okay, the size of the crown, the major distal width of the cusp of the tooth should be equal, or it should exceed. Basically, it should exceed the width of the context which we are fabricating in your fixed partial denture. We make sure that it is slightly wider so it can take up more amount of occlusal loads. Okay, we can see in the diagrams. So basically, when we have the major distal width of 5 millimeters, you can see in the next diagram which is next to present on your slide. So the central incisor is having the major distal width of 5 millimeters in your natural dentition. When we go for a contact, it is more than your natural tooth. So basically, we make sure that it is slightly wider to take up the load. The occlusal anatomy, we make sure that the ridges and the grooves will be sharp enough to have the shearing action. It will reduce the friction between the two surfaces. So make sure that should be out of the contact, or the minimum contact should be there. So while making the cuspal anatomy, we make sure that it is most efficient for the mastication, thus reducing the occlusal loads for your teeth. Same thing was said by the Stallard. We go for the root configuration. When we have the root configuration straight and the curve or the multilateral root are present, that have the various effects on your selection of the abutment. So basically, whenever we have the forces will be transferred through the abutment from the coronal part to the long axis of the tooth till your root surface. So we make sure that the root surfaces determines the ability for your abutment to transfer the masticatory forces to support the bone. Okay. So basically, if you have the number of roots, the first thing, the number of root, the more number of the root, the wider the root, we have the more amount of periodontal coverage. If it converges or the fuges, it is more better for your abutment selection. So basically, it is a conical configuration we see in your abutment tooth. So the next is the size of your uh, size of the teeth, which is quite important for the selection of abutment. So the teeth should have the longer root present. Okay, it should be if the roots of the tooth are longer, then it will have a stronger abutment, which will be better than your shorter tooth. The length of the root, the size of the root is very useful for the selection of abutment. If it is more, you will get the more amount of abutment will be stronger enough to withstand all the forces. The width of the roots also plays very important role. If the width of the labial width of the root is more, then it is preferred over the less width of the shape of the root. If the irregular shape of the root is present, it is always preferred for the roots which have the conical roots and the straight roots. The crown root ratio is one of the important part for your selection of abutment tooth. So basically, what is crown root ratio? It is the length of the tooth from occlusal to the alveolar bone, and which is compared to the length of the root embedded in the bone. Okay, got it? The clinical crown and the clinical root. So basically, we have the anatomical crown and anatomical root. So when we measure the length from occlusal surfaces to the crest of the alveolar bone, and the length of the root which is embedded in the bone surface. That is the crown root ratio we are talking about. So the clinical crown root ratio is around 2 is to 1 and the anatomic ratio is 1 is to 2. So basically this is the one of the MCQ which is again commonly you asked in your images and the all the CET exams which will be taking places for the which will be taking places for your PG examinations. So the optimal crown root ratio is basically 2 is to 3. Optimal crown root ratio. Again, there is stress on the these word optimal crown root ratio. So basically, the minimal crown root ratio or the acceptable crown root ratio is 1 is to 1. It is given in the Schillingworth. We can see it in the diagram. That the optimal crown root ratio, the surface is the clinical crown or the area from the occlusal surface to the alveolar bone. That is your clinic crown ratio, that is 2, and the root ratio is the length of the root which when it is embedded in the bone, that is 2 is to 3. At least optimal ratio should be 2 is to 3, and the minimal it should be 1 is to 1 given in the Schillingworth. A similar thing was said by various authors. So basically there are average forces which can be exerted by a fixed processes on, so that these are the forces given in this slide. You can see the removable partial dentures have the least amount of the forces, that is around the 26 pounds, and the FPDs are having the relatively less stresses when compared to the natural dentition, that is around 54.5 pounds when compared to the natural dentition. The natural dentition have the more amount of stresses, that will be around 150 pounds in your mouth when the FPD or the natural tooth are present. Okay. The next and the most important part is periodontal ligament area. The length of the teeth have the greater surface area, and that will be better for your added stresses present on the tooth. So basically, the supporting bone plays a very role. If it is lost, we have a periodontal disease, and the teeth involved can have the lessened capacity to serve as an abutment. So basically, if the periodontal diseases are present in the periodontal ligament area or the bone loss is present, you cannot take up that tooth as a abutment tooth. So basically, we can increase the number of pontics or the abutments. As we know the Antes law. Antes law dictates that. So basically, it is similar to your removable partial denture. So when we observe in the fixed prosthodontics, the combined pericemental area of all the abutment teeth supporting a fixed partial denture should be equal, or basically it should be greater than the pericemental area which we are going to replace. Okay. If your if your 6 is missing, so the area of the 2 6 or 1 6, the first molar missing, should be more than the area we are going to replace with the your fixed partial tension. We make sure that it should be equal or the greater than that. Okay, this is the perisegmental area. Now we have the two missing teeth, that is your second premolar and the first molar. So now for that we have to take the combined root surface area of the premolar and the second molar is approximately equal. Now we can go for the another abutment which can give us the proper root surface area. In this slide we can have the proper areas of the root surfaces of the various teeth which can have been reported by the uh, pen to make sure that the average square millimeter root length present or the surface area present in the maxillary and the mandibular tube. So the long axis relationship, we can see the long axis relationship. If the abutment is not tilted more than 25 to 30 degrees, it can be used for the preparation of the abutment. So we have the biomechanical considerations. The biomechanical considerations include various parts. The first one is the length of the span, occlusion level, thickness of the bonding. So basically, the length of the span and these other factors are very important when we consider the biomechanical consideration for the fixed partial tension. Okay, how it is important. So when we have the bending forces on your tooth, we can see in the diagram given below. Okay, there is a 3-unit bridge and the center tooth, which is a pontic, having the more amount of forces acting on that. So it tends to bend or deflect. So the formula is given for the fabrication of fixed partial tension. So we make sure that the bending forces, that is the unit deflection for your fixed partial tension, is considered as a x for the given length of span. That is your p or pi. So basically, it varies from the tube length, and it should be greater than the span length should be having for your occlusion thickness of the pontic. So we make sure that a 3-tooth pontic should have the around bending forces, sorry, bending forces around 27 times as the single pontic. So suppose we have the area of your fixed partial denture 2p. So the 3 times will be the more amount of deflection can be seen in the fixed partial denture. That is your 8x. Similarly, if you have the 3p areas, if the areas of your fixed partial denture is around 3p, then the 3 times the cube of your 3 is around 27. So the 27 times your single pontic will have the bending or the deflection forces. So when we compare it, it should be the cube of the length of the span divided by the occlusion gel thickness of the pontic. So this should be considered while making any fixed partial denture. If the length of the span increases, there will be more amount of bending and deflection forces present on the tooth. So the next part is your dislodging forces on the FPD. So the FPD has the dislodging forces present. So the dislodging forces on FPD can tend to act as a mesodistal direction. The direction acting is the mesodistal or the mesodistal direction. So basically, we make sure that it can be opposed with the buccolingual directions in a single two restorations. The preparation should be modified accordingly by giving multiple grooves. The presence of grooves will help you to restrict the dislodging forces acting on the fixed partial tension. When we go for the when we go for the double abutments, we make sure that it is parallel to the path of insertion. It should have a proper favorable crown root ratio, and the length of the span should be managed with the help of proper crown anti-slur. Okay. Now we have can be used as a secondary abutment to the first premolar as a primary abutment, because if your number of teeth are missing, we can use as a canine primary abutment if your premolar is missing. So the curvature of the arch also plays very important role. So we make sure that we are not replacing more amount of the teeth. The anti-slough should be taken into care that it is maintaining all the tooth in a proper area. So we have the arch form considered for the maxillary and the mandibular incisors. There should not be any offset of the torque present while fabricating any fixed partial dentures. Now we have the questionable abutments like pyre abutment. Okay, pyre abutment is having the natural tooth or a natural implant abutment that is located between the terminal abutments. So basically, we have a center abutment present, which is having the edentulous area on the either side, on the both the sides. Okay, and it can be replaced with the help of a fixed or the removable dental prosthesis. Okay, other name for the pyre abutment is the intermediate abutment, the abutment present in between the two abutments. So we can have a rigid connector can be given, or we can prefer a non-rigid connector in such cases. Okay, to So basically, we don't use rigid connectors because these are contraindicated because of the physiological tooth movement. It tends to move the tooth. The arch position of the tooth plays vital role because the arch position of the tooth is different. It is very the bending and the reflection forces will be more on that tooth surfaces. The disparity of the retentive capacity of the retainer again play a vital role. Okay, and there are various studies which shows the amount of curvature and the length of the span have the detrimental effect on your fixed partial tension. So these are the studies which was given by various authors. Now we have the non-rigid connectors. These are the best recommended treatment plan for your pyre abutment or the intermediate abutment. So basically, it is designed in such a way that it has a key and key way pattern present. So basically, we can give a key of a connector should be placed within the normal distal contour of your pyre abutment. You can see in this diagram. In the distal abutment, you have the keyway, and the key should be placed in the medial side of the distal contact. Okay. So these are the proper recommendation for your non-rigid connector. The first one is when we have the key and keyway in a proper phase, it will have the least amount of forces acting on the pyre abutment. Okay. So we don't have the deflection action on the tooth. There is really no shifting the tooth towards the mesial side of the distal side of the pyramid. There will be no physiological mobility seen in the tooth. Now we go for the canine abutment. Okay, sorry, the tilted abutments. When we have the tilted abutment, we tend to correct it with the help of various methods. Okay. The management can be seen. You can encroach it slightly if it can be done with the help of recontouring of the third molar. So we can recontour it properly. You can see it in this diagram. Okay. If it is not possible, then we can go for the orthodontic treatment also. We can upright the molar with the help of your orthodontic movement. Okay. Now we can have the proximal crowns, okay. Or we can use the placement of proximal crowns only on the tilted abutment, which will give us the proper parallelism for your prepared tooth also, and it conserves the tooth structure also. But it has tendency to get the secondary caries after the cementation of the crown or the prosthesis. Okay, if it is not given, if it is even it is having the so design should be, it is simple. Three-quarter crowns can be placed if the rotation is 90 degrees. Okay. We can go for a telescopic crown. Crown over a crown. That is your telescopic crown. Telescopic crown will correct the uh, angulation of the molar, and we can give another 3-unit bridge over the telescopic crown. It is very easy to fabricate. It has the similar groove present like we give it in the key and keyway. So these are the non-rigid connectors for you. The use of cantilever fixed consideration, it is again a questionable topic. You can use a cantilever, but your abutment should have the lengthy roof present, favorable configuration should be there, long clinical crown should be there. If it is not there, it is very difficult to give a fixed partial tension. The good crown root ratios are must in these type of questionable abutment, that is your cantilever abutments. The cantilever is given in when we have the good crown root ratio, the healthy periodontium present. Okay. Now when we have the endodontically treated teeth, it is must that we should give a fixed partial denture, otherwise your teeth will fall apart or it will get fractured. So basically, if you want to replace a canine for the fixed partial denture, the ideal replacement will be your implants followed by the fixed partial denture. Okay. So basically, the canine is present, and if it is subjected to the stresses, it has the more amount of stresses as it is a pontic. So we make sure that we go for an implant other than a fixed partial denture. Now that's how we conclude the topic. The important part in this topic is the definition of the abutment. The various factors we go for the abutment selection should be evaluated properly and written properly for your examination. There are various questions which can be asked in your MCQs or the section A should be taken care of before you go for a preparation of this topic. So basically, it will come as a SAQ. Sometimes it come as a LAQ also. So this is the end of the your topic, and next time we will be discussing about